This is a surgical unit, so in principle we only take children who have got an acute trauma and who are acutely raped. Children who are prolonged sexually abused over a prolonged period of time, chronic abused, for instance teenagers, are not treated here because there's no physical trauma. We treat children with physical trauma. So all the kids who come here, they are generally bleeding or they've got lacerations. And what we do, first of all, what is very important, to try to traumatize the child as little as possible. To give an example, with a brain injury, if someone has been hit by a car and his brain is damaged, you cannot change, when the child comes to the hospital, you cannot change the injury which occurred at the moment of the accident. But what you can do is you can prevent secondary trauma. You can make sure that the brain has got the best circumstances to heal in the most appropriate way. So you must make sure that there's good blood pressure and there's good oxygenation of the blood. All these secondary things in order for the healing process to take place. That's the same with the child rape. It is a terrible trauma usually to the child, but we cannot change that in hospital anymore. But what we can do is we make it better for the child and be as objective as possible. Because if you're confronted with a child who is sexually abused, it's a very emotive issue. And even lots of doctors, we've got lots of junior doctors, we are a training hospital. And when they are faced with a baby or a small child who was raped, it can be very traumatic for the doctor, and the doctor actually can start crying while he's examining the child, or become very agitated and cross because he's suspecting that the parents were not taking care of the child or maybe were involved in the abuse. And of course, if the doctor in any way gets angry or agitated, the child is not able to recognize that this anger or frustration is not focused on him, but on the person who performed the abuse. So for the child to have been raped, come to hospital and then see a doctor, and the doctor goes, "Oh my God, what's happening?" I mean, that's a disaster, because it reinforces the thought of the child that something terrible has happened to him. So that is to deal in the most humane way with your kids. So be very sympathetic to the child, and nearly always, if the child has been acutely raped, it will be very painful to examine him. So the preferred method we use is to give a general anesthetic to the child and then examine it under anesthesia. For two reasons. The first, to make sure that the baby doesn't get pain, because if there are tears either around the vagina or the rectum, the anus, it is extremely painful to look there and the local. And the other thing is that the child will not remember anything, because the child just goes to sleep, and when he wakes up it's all done. So there's absolutely no trauma for the child. Of course, we've got advantage that we are a pediatric or children's hospital, and we've got experienced people making the children to sleep, and that is a requirement, because to give an anesthetic to a child can in itself be quite complex and have its own complications.